Thanks, Deborah. Good morning, Chairwoman Brabec and members of the Health Policy Subcommittee on Behavioral Health. As was mentioned earlier, my name is Sean DeFore. I'm the President and CEO of Southwest Solutions. We're a comprehensive nonprofit behavioral health and human services provider located in Southwest Detroit, but providing services throughout the city and within Wayne County. In addition to behavioral health, we do a range of affordable housing and real estate development and economic empowerment work. And our goal is to improve the quality of life, self-sufficiency, and success for individuals and families in Detroit. So I appreciate the opportunity to share with you some of the areas that we believe are a priority for the behavioral health sector. And I'm going to add to some of what Deborah mentioned and provide some detail, but also give just a few concrete suggestions for how this body could really help improve access and quality of care for all Michiganders in the state. I'm sure you've heard from others, and I suspect that you're all well aware that we are in the midst of a pretty significant behavioral health crisis, and we've seen need continue to increase pretty significantly year over year. We happen to serve in a community in Metro Detroit that is very diverse. Southwest Detroit is about 60% Latino, about 30% African American. So very diverse even within the city of Detroit, and a population that is suffering significantly from poverty. And what we've seen is that unaddressed mental health needs in our community really help exacerbate some of the social inequities that exist, whether they're economic, or access to employment or income, overall health, not just behavioral health quality. And so we see the devastating effects of that firsthand when the folks in our community aren't able to access the behavioral health services that they need. And as Deb mentioned, we are also in the midst of a behavioral health workforce crisis. And I don't have a magic wand to make suggestions to you on how to fix that. But I do have a few concrete things that I think this committee can do and support that can help ease that workforce shortage, improve access to care, and improve quality of care for all Michiganders. And I want to highlight those three. I'll start with the first, which is the Department of Health and Human Services is working to expand a national model known as the Community Behavioral Health the Certified Community Behavioral Health Clinic Model, CCBHC. And we happen to be an organization that received some funding to equip us to serve as one of these CCBHCs. My colleague, Carrie Walker, is going to talk in a lot more detail about what these CCBHCs do. But I can tell you that as an organization that received an expansion grant from SAMHSA, the Substance Abuse and Mental Health Services Administration, to build capacity to be a CCBHC, over the past 3 years, this grant has allowed us to develop and expand our capacity and specialized services that our community needs. And as I mentioned, Carrie will give you a little bit more detail about the model and how it works, but I wanted to give 3 examples of how that CCBHC model has really transformed our community. So first, as a result of our CCBHC grant from the federal government, we were able to add nurse practitioners who work alongside our behavioral health clients to also treat their physical health needs. So we have many children that suffer from asthma and anxiety, and it's amazing how those two conditions actually interplay off of each other. And you may have seen articles recently that talked about how Detroit is a hotspot for asthma. And asthma results into higher absentee rates for youth in school and has a compounding effect over the term of their life. For the first time, we had clients who were seeing us for behavioral health who were also able to see our nurse practitioner and be treated for both conditions simultaneously. And that was because of the CCBHC funding that we received. This also applied to unhoused individuals that we saw that had severe mental illness, but also unmanaged or undiagnosed diabetes. Parents with depression and COPD, again, 2 conditions that just compound each other. And for the first time, they were able to receive care in one place for both conditions, or even have both conditions diagnosed when they hadn't before. Because of the CCBHC expansion grant, we were also able to add and expand comprehensive substance use disorder services. And for us, that included medication-assisted treatment. And because of our ability to add that service, we now treat over 80 individuals every year who suffer from severe opioid disorder. And I'm sure I don't need to tell anybody on this committee, we're also in the midst of an epidemic of opioid addiction, overdose, and overdose death. And without these funds, we would not have been able to build these services and serve those 80 people a year who I can almost guarantee their lives have been saved because of the services that we're now able to provide to them. And finally, we were able to serve 500 more children every year because of our expansion as a result of these funds. These were children who had mild to moderate behavioral health issues, anxiety, depression, substance abuse, who wouldn't have qualified for services in the publicly funded system because they weren't severe enough, and couldn't afford to get services from the private system either because there wasn't access or their parents couldn't afford it. And it was because of the CCBHC model and this funding that we were able to serve those 500 youth a year. So what does this mean? The federal government has invested for the last several years in building the capacity of organizations like ours to be certified community behavioral health clinics. We need this body to support legislation to fund the state's expansion of the number of CCBHC sites, especially in the state's most populous area, Southeast Michigan, particularly the Metro Detroit area. And most importantly, right now the criteria that the state has set out for organizations that can enter the state demonstration to be certified, nonprofit organizations like ours are not eligible. And we need this body to make sure that the state allows organizations like ours who have these expansion grants, who are able to provide the services, to be eligible to be certified this fall. We are on a grant that runs out of funding as of September, and if that doesn't happen before September, all of those services I just described to you will go away. We will not be able to afford to provide them. That's 500 kids a year, that's 80 more people a year that may die from opioid disorder, and untold numbers who may die because their chronic diseases and behavioral health issues aren't managed together. So that's the first. Second is around the telehealth and administrative burden issues that Deb Matthews spoke to a little bit ago. I want to just provide a little bit more detail on that, starting with the telehealth. I'll talk about Southwest Detroit, our area in particular. We happen to be in an area where only 42% of our families have access to reliable and consistent internet. When the public health emergency was put into place and the flexibilities that came with it for telehealth were allowed, it was a godsend for our families because they could, for the first time, access behavioral health services that they weren't able to before because they didn't have transportation needs, they had childcare issues, they couldn't afford to get where they needed to go for an in-person service, and they could access it through audio, telephone, or telehealth video if they had access to it. The problem is without that reliable internet connection and with the new policy that DHHS has put into place, many of those families will not be able to access the services they need because they don't have the devices, they don't have the internet service, or for some of our older population or more severely in poverty population, they don't have the tools to be able to access video conferencing. And so audio only was one of the best ways they were able to access care. One of the things that this body can do is ensure that the new policies set out by the Department of Health and Human Services allow audio only, and that telehealth is allowed for some of the codes that it's currently not, like case management and targeted case management. Those are common services that are provided to multi-problem families, severely, persistently mentally ill individuals. And if we can't help folks access them through telehealth or audio only, they will not get services and they will get worse, period. Second is the administrative burden for behavioral health clinicians. So our average productivity rate is probably about 55%, 60% at best, which means 40% of a licensed clinician time is spent in paperwork, in getting authorizations for care or completing various service plans. We are not going to be able to magically produce double the number of licensed clinicians to provide care, But if we could cut that paperwork burden in half, we could instantly increase our capacity by about 25 to 30% to help people access services. And so one of the things I would ask this body to do is support a statewide effort to reduce administrative burdens, make them look more similar to commercial system standards, which are significantly less, and help us stop these licensed clinicians from leaving the public mental health system and going to private practice or schools or hospital systems, because they can do what they trained to do, which is help people and not sit in front of a computer for half of their time completing paperwork. Third and final area I want to highlight is preserving and advancing efforts around integrated care. And those efforts are currently at risk because of a work group that is working within the Department of Health and Human Services, making recommendations around conflict-free access and planning. And this is going to get a little bit weedy for those of you who may not be deep in the behavioral health space, but bear with me if you would. First, let me just emphasize that the benefits of integrated and coordinated care are well documented. And frankly, every form of forward-looking behavioral health model that we're investing in right now is all about integrated care, whether it's the CCBHC model I've spoken about, opioid health homes, wraparound services, patient-centered medical homes, I could go on. All of those are based on integrated and coordinated care approaches, and especially for children and adults who are complex cases, who are multi-problem families and individuals, that's the kind of approach that we know works. Part of the problem is the work group within MDHHS, the Conflict-Free Access and Planning Work Group, is seeking to separate the access to service, the eligibility for services, and the person-centered planning development from the actual service delivery. And it's being done in the name of a conflict of interest concern that has been raised that we believe is largely invalid. And if the recommendations that they're making go forward, would actually create a separate administrative entity that manages the eligibility review, the person-centered planning development, separate from the actual service delivery. We think that's going to create additional barriers for people seeking services. It's going to weaken continuity and integration of care. It's going to increase administrative costs, and it's going to make an already complex system more complex. So what I'd like to encourage the committee to do, and for those of you that really don't know what I'm talking about, it would be helpful to maybe just take this next step, which is to review the work group's recommendations, hold a hearing and ask the work group to explain to you what they're recommending and why, and also invite the Community Mental Health Association of Michigan to that hearing so they can share with you legal experts that have ruled that what the conflict-free access and planning work group is doing does not meet CMS standards, actually makes the state's compliance with those standards worse, worsens care, and isn't something that is required to do right now. So I think by advancing these three common sense recommendations, we can help ensure that Michiganders have access to high quality behavioral health care, the care that they need and the care that they deserve. So thank you, Chairwoman Brabec and the rest of the committee for hearing my recommendations. And I'll turn it over to Carrie Walker.